I was 32 years old and I was on vacation in Europe, and I started to notice some pretty significant pain in my left hip. It was a horrible, kind of like, I felt like I was getting stabbed with a knife in the very front of my left hip.
The typical pain pattern for a patient asking for hip resurfacing, it's activity-related pain, and it's interesting the way they'll describe it. They'll say, well, I did my activity, but I just paid for it afterwards. That's a very common way that they'll describe their pain pattern. Patients also come in with just functional loss. They can't do what they need to do. Their hip's stiff, they need more energy to move it because the friction's high, so they'll tell you a combination of those symptoms. Pain's always part of it.
So when I went to the first orthopedist that I went to was when they first said to me that I'd have to have a replacement, and that was devastating to me. To think, you know, here I am, early 30s, and you're telling me that I'm going to have a hip replacement that 60-year-olds have, and what's that going to mean to my lifestyle, and how many of these am I going to have? You know, all those fears and concerns. It was very, very difficult.
95% of patients that have hip resurfacing can do just whatever they want, and that can be a lot. At
some point, within a very short period of time, a really good friend of mine here in Seattle and my mom both heard about a resurfacing procedure. We didn't know if I would be a candidate. I didn't know any details about it, but the benefits were so great. You know, not having limitations in activity level. The fact that they say it's a little bit of a quicker recovery. The fact that I could keep all of my bone, all those things were huge to me because of my age and because of my lifestyle.
Your natural hip is still there. So when you ask patients, and this has been done several times, they'll say, my hip feels normal, it feels right, I can use it any way I want, I can put it anywhere I want. So if someone wants to run, they feel they can. If they want to do yoga or Pilates, their hip feels like they can put it in any natural position without any difficulty. Their leg feels like it's the correct length. So everything about it feels natural.
As much as I was interviewing him to learn if I was a candidate and to see if I liked him and thought he was a good doctor, he also really made sure that I was a good candidate as a patient. And I was really nervous because I wanted it to work. I so badly wanted it to be an option for me, and I was so afraid that he was going to say, nice meeting you, but you're just not a good candidate.
My answer to the question, is hip resurfacing appropriate for a given patient, is usually yes, but it's not always. We have criteria that we use, and they're pretty simple criteria. We look at the patient, what their motivation is, what their expected activity is. Do they need a very high performance hip, is basically that question. Typically the answer is yes. We look at their bone structure. Is their bone structure healthy? And typically it's healthy enough or very healthy, and so then the answer is yes. Then the other questions have to do with are they a good medical candidate? And most of the patients that contact me, all those questions are answered in the affirmative. And we tell them they are a good candidate and go ahead and do it.
Dr. Pritchett is wonderful. He's, unlike a lot of orthopedists, he's not cold. He's just so kind that, you know, he looked at my x-rays and he said, you definitely need something done. And by this point, I was having a hard time even walking. I mean, I was in so much pain. So he knew that I needed help. And he said, he talked to me about the fact that in the past, I probably wouldn't have been a candidate because of the metal-on-metal resurfacing. And he said that the failure rate on that metal-on-metal was significantly more for women because of the weight of the implant that they use. He told me right away about the polyethylene and told me that he thought I would be the best, that would be the best option for me.
Every material, since it's a moving part, has some wear debris. So it gets absorbed, it goes through the bloodstream, it's excreted out your kidneys, in fact. And while it's doing that, there are some concerns about the safety of it. Well, polyethylene doesn't do that. There are no reactions to the wear debris. We've had now beginning our 12th year of a fully cross-linked polyethylene material, and never looked back yet to have a failure of the bearing surface in the patient. And the wear simulator data, same thing. We can run it just as long as the wear simulator will go without it failing.
My activity level is more probably than I was before. I'm not a collegiate athlete anymore, so it's, you know, an adult type activity level, but you know, I participate in Zumba and have discovered that and love it. I bike to work on a regular basis and for fun, do rides, and I hike, and you know, there really isn't anything that I can't do.
The big benefit to the job is that you can help patients that have a problem that's really going to disable them and change their life and hear back from them. You hear comments like, well, you gave me my life back. This has changed my whole family's life. That's a real positive reinforcement for what we're doing.
Well, I would say don't put it off, first of all. If you have pain and there's something that you can do to solve that problem, there's really no reason to not do it. You're going to have your surgery, you're going to recover, and you're going to move on to a better life. That's what my experience has been.